Welcome to day 20 of our 30-day series on overcoming fears. Today, we're diving into a common but often under-discussed fear, the fear of needles, or trypanophobia. For some, it's not just a minor discomfort. It's a deep-rooted anxiety that can lead to avoiding necessary medical care. If you're someone who dreads the thought of needles, this video is for you. Fear of needles affects millions of people. In fact, around 20% of adults avoid medical care due to this fear. It can range from mild anxiety to full-blown panic attacks. And it's not just about the pain. For many, it's the anticipation, the thought of the needle breaking through the skin, or even a phobia triggered by the sight of medical environments. But the good news is that, like any fear, this one can be managed. Today, we'll break down the causes of needle phobia, discuss why it's essential to overcome this fear, and offer practical strategies to help you face it, one step at a time. Let's start by understanding the roots of this fear. Fear of needles can stem from a variety of experiences. Some people develop it due to negative past experiences, perhaps a painful injection, or a traumatic medical procedure. Others might inherit this fear from family members or friends, where hearing about bad experiences plants the seed of anxiety. Interestingly, there's also a biological aspect. The sight of needles can trigger a natural fight or flight response, the body's way of protecting itself from perceived danger. In some cases, this results in fainting or dizziness, known as vasovagal syncope. But avoiding needles altogether isn't a long-term solution. Medical treatments, from vaccinations to blood tests, are crucial for staying healthy. So, learning to manage this fear is essential. Let's explore a few techniques that have been shown to help people overcome their fear of needles. The first step is exposure therapy. This involves gradually exposing yourself to the source of your fear in a safe, controlled manner. For instance, you could start by looking at images of needles, then work your way up to watching videos of injections. The idea is to desensitize your brain, so the sight of a needle no longer triggers extreme anxiety. Another technique is controlled breathing. When we're anxious, our breathing becomes shallow and rapid. By focusing on slow, deep breaths, you can reduce your body's stress response. Try this. Inhale for 4 seconds, hold for 4, and exhale for 4. This helps to calm your nervous system and brings your heart rate down. Another effective method is visualization. Picture yourself in a place where you feel completely safe. Maybe it's a quiet beach or a cozy room. Focus on the sights, sounds, and smells of this environment whenever you're in a medical setting. This shift in focus can make the experience much more bearable. If these techniques feel difficult to do on your own, consider talking to a therapist who specializes in cognitive behavioral therapy, known as CBT. CBT is designed to help you challenge negative thought patterns, particularly the what-if thoughts that fuel your anxiety. Over time, you can retrain your mind to approach needles with a more rational, less fearful outlook. Lastly, don't hesitate to speak to your healthcare provider about your fear. Medical professionals are trained to help patients with needle anxiety. Some clinics even offer numbing creams to ease discomfort, or they can use smaller needles designed to minimize pain. Remember, facing a fear of needles doesn't mean erasing the fear altogether. It's about learning to manage it, so it doesn't control your life. Take small steps, celebrate every victory, and don't rush the process. Whether you've avoided vaccinations, blood tests, or medical procedures due to your fear, each step you take toward overcoming it brings you closer to better health and peace of mind. This journey is about progress, not perfection. Thank you for joining us on day 20 of our series. Overcoming the fear of needles is a challenge, but with the right tools and mindset, you can face it head on. Remember, you're not alone in this. We'll continue tackling fears throughout the rest of our 30-day journey. So make sure to subscribe, hit the notification bell, and join us tomorrow for day 2. Stay strong, stay brave, and keep moving forward.